This was a very important topic. I know that we are running a bit late, and I know the smell of food is very, very inviting. But please be patient. What we are talking today is really important. Financial abuse is a very, very real thing in the area of domestic violence. And please, it's very important for women to have a credit history of their own, especially if they separate. Then it's very hard for them to get loans. They have no credit history. So while we want to share all our money and be together, an important takeaway from that is that we do need to maintain our own account as well. And keep an eye on money. I have had so many cases where I've had young girls who have given all their money to the husbands. Sorry, husbands, all are not like that, but there are some who are like that, who have taken the money and sent it all the way to India and then left the girl here with nothing. So please be aware of your money, take care of your money, take care of yourself. Thank you.
Now we have a different topic and choose to challenge infertility. Probably we should use a better term, fertility, rather than infertility. Infertility is a very negative terminology, but we have to challenge infertility and make them more fertile. So infertility is inability to fall pregnant after certain years of trying in a married life or in a partnership. So there are various reasons for this, both male infertility and female infertility, and it's becoming a very common problem in the community due to various reasons and multifactorial causes. So this can lead to emotional disturbances, domestic violence, and depression, and also relationship problems. So today we have Dr. Sonal Karia to explain to us how challenging it is to the treating doctors and the partners to face this problem. And Dr. Sonal Karia is a fertility specialist, very well accomplished, and she is associated with world-leading fertility specialist called Genea. And to say a few words about Sonal, I have known her for a number of years, and she is very, very efficient, and she is so humble and very good to the patients. And she has looked after a lot of my patients in this area of infertility. And she is a staff specialist in Obstetrics and Gynecology in Campbelltown Hospital, and she is a fellow of the Royal College of Australasia and New Zealand. And she has got a lot of other qualified subspecialties, reproductive endocrinology and reproductive medicine, and also masters in genetics from Sydney University. And her special interests are genetic screening for inherited disorders, recurrent miscarriages. She is also a specialist to treat menopausal problems, general gynecological problems, and she is also specialized in pre-implantation genetic diagnostics, which is a very, very difficult part, which involves very micro-technique procedures. I don't know how you do it. It's a difficult branch. So here is Dr. Sonal Karia, and we are very proud to have her here as one of the speakers challenging infertility.
Thank you so much. I don't know whether I really deserved all that, but like somebody said earlier, I'll take it because it comes free. I'm not paying for it, so I guess that's all right. Fertility, I don't know where to start and where to end. It's taken me about 25 years of obstetrics and gynecology and about 15 years of fertility practice to be able to stand on this dais and speak a few words. And before we start talking about fertility, I'm just going to talk a little bit about how culture influences everything that we do, and especially reproduction, sexuality, and fertility. And a lot of you might be thinking, what does a second-generation Indian who doesn't have children and who lives by herself and can't look after anybody else talk about fertility and culture? But I can tell you, I have seen it myself because I was born in a household where we were 11 people living together in a one-bedroom unit, starting from my great-grandmother who was born in 1893 to my grandparents, my parents, and then the three of us. And I have witnessed how different generations in India have actually thought very differently about fertility, about marriage, about reproduction, and how important it was for them to have that upper hand in terms of, what should happen in the family, how many children should somebody have, when should you get married, who should you get married to. And I don't know how I escaped all that, but I'm fortunate to say that I was born to parents who are traditionally Indians, and I still am a very traditional Indian at heart, but we are not orthodox in a negative way. And that's what brought me to this dais today and got me to the point where I am today. It's a little bit challenging to kind of outline what happened, but younger days were very difficult. Finances were very tight. Like I said, we were in one bedroom unit, 11 people living there. And the day came when I had to make a career choice. And I decided to take medicine. And my father was really taken aback because I was the first person in the entire extended family who chose medicine as a career. And he just walked to me and said, I don't know anything about what you're trying to do. We have no idea of what medicine means and what it means as a career. And the only thing I told him is, you pay my fees and get me my books, and the rest I will manage. And that from that point, I couldn't look back because I had to manage it myself. I had absolutely nobody in the family who could guide me, nobody in the extended family who could guide me, and we just walked the process. And then came a day when I got an opportunity to come to this beautiful country. And you won't believe it. The first time the opportunity came across, I said, no, how can I leave my parents here and go? I need to look after them. There needs to be somebody to support them. And I actually gave it up. 2 years later, somehow it came back again. And my father said, look, this is the second time it's coming to you. Maybe there is something in it, Why don't you go for a year? I came for a year's fellowship. I thought, let me go and have a look at what happens in a very different part of the world and how do people practice there. And by then, I was already a practicing fertility specialist in India. But we know that India is very different compared to the rest of the world in terms of technology. So my aim was to come, learn something, go back and apply it. And I went back in 6 months because I actually didn't like it. I closed my bank accounts, I paid my taxes, I closed everything, and I said goodbye. I was much better in India. I don't know what I'm doing here. Why am I here? And in 2 weeks, I was on a flight back to Sydney. And till date, I haven't figured out why that happened. I call it my destiny. I call it my fate. But the second flight that I took to Sydney was the life changer. On that flight, I made the decision that I'm not going to come back without an international qualification, even if I do come back. And I'm going to work towards having an international qualification, having a degree that I want, practicing fertility as my career. And as we go ahead, I'll tell you why it was fertility and nothing else in terms of gynecology. So that's a little bit of background about myself. And I can't say it has been a very difficult life. We were very well supported, but certainly financially, it was quite difficult in our younger days. So if we start, the only disclaimer I have is I am a visiting medical officer at Genea, which is one of the world leading fertility companies. And I'm really, really happy and proud to be a part of this organization that has now got more than 35 years of experience in the industry and has brought joy to millions of families and millions of couples around the world. And I'll prove it as I go along because it's the more cutting edge technology that we need to look at that we provide today, which is bringing this joy. So, like I said earlier, I'm going to just run you through, I'm just going to run you through what culture means and how culture influences what we do in terms of sexuality and reproduction. And what do we mean by culture when we start talking about culture? It just means that there's a group of people who share certain characteristics, probably speak the same language, probably have the same thought process in terms of their cuisine, religion, maybe some of their social habits and arts and music and hobbies and that sort of stuff. But I can tell you, India is not one culture. I'm sure all of you agree. India is an amalgamation of hundreds of different cultures because it holds a sixth of the world's population. I'm sure we have more Muslims in India than in Pakistan today. And that's what India is. India allows all the cultures to respectfully live in one country. We are the world's biggest democracy, and that makes me feel so proud that we can actually hold a sixth of the world's population and still be the world's biggest democracy, which is almost impossible to imagine in some other countries in the world. And because of this, I think we have to acknowledge that culture becomes a very important factor in terms of determining the level of human fertility that we are talking about. We have to focus on the attitude and the different motivational factors at a community level that then are responsible for explaining the reproductive behavior in that community. So there are various factors that are influenced by our culture. One of them is, of course, the practice of marriage. And I'm sure most of you know that at least till a couple of decades back, marriage used to be the center point of somebody's life. You hit about 25, and automatically people are staring at you thinking, are you married? Do you have a partner? If you do, and if it's 1 year down the line, why are you not pregnant? Why don't you have a child? They don't know what's going on in your life, but this is the general attitude that you would have seen if you lived that life in India that I did, probably in the late 1990s, because of course from 2004 I've been here. And now when I go back to India, things have changed so much. My God, in the last 20 years, you see, everything has changed. There's no longer importance of marriage to have a family. People can have a family in a live-in relationship, which is quite shocking to my parents at least, if not myself, because obviously I have adapted as times have gone by. Sexuality was sometimes thought to be only exclusive to married couples, and it's no longer the case in India, which I think is a very positive move, because you don't need to have a label on your head just to have a relationship with somebody. Our culture also influences our nutrition, our reproductive morbidity, because obviously if women are not healthy, they cannot give birth to a healthy next generation. And I think that's so important to understand, because we are the ones who bear the burden of moving this world forward. In fact, so many times my patients tell me, the doctor, it's so hard to be a woman, right? Men don't have to go through so many things that we have to go through. And then I tell them, yes, it's true, but God gave us the capacity to get this world going and to keep this world moving forward. And that's where you should be proud of yourself, because a man does not have that capacity and a woman does. And God had to make a woman so that this world could continue surviving. And that's where I see the pride in myself, in my existence as a woman. As much as I have not born a child myself, I've probably been involved in more than 10,000 births and probably been involved in a few thousand IVF cycles by now to bring some joy to those families. We also have to think about the societal attitude towards childlessness. And being childless in India, at least till a couple of decades back, was a huge stigma. I remember friends not being allowed to attend weddings. I remember friends who would not be allowed to attend a ceremony that we would conduct during a pregnancy when women are pregnant to bless the child, because it was just a big stigma that how can you be childless when you are married for a certain period of time. Of course, there are differences in terms of the attitude based on the gender of people, and there is a general attitude of the society towards infertility and also towards fertility treatment. People don't want to be seen entering a fertility clinic. And I must admit that it's not only in India, it's also in Australia. That was the general feedback that Genea got a few years back, that we don't want you to have this big board outside your office which says Genea, because when we walk out of your office, people know that we are coming here for fertility treatment. So we had to change all that. We had to make bags that don't have a Genea logo because they have to carry stuff from our offices. And that's the type of attitude that we are talking about. Even today, in a first world country, there is a stigma associated with fertility treatment. And I cannot imagine why that should happen, because reproductive medicine is like any other part of medicine, and it should be considered as a part of mainstream medicine. In terms of continuing our talk about what culture influences, sorry, I think this doesn't move very well. Yeah. So of course there is this huge issue of unnatural conception. And a lot of what I do in my practice is of course unnatural conception, because a lot of couples conceive through IVF. And there can be nothing more unnatural than your baby being conceived in a plastic dish, right? Of course it's unnatural, we agree. But that unnatural procedure has brought joy to millions of couples, and that's where we need to focus our attention, not whether it's happening in a plastic dish or a plastic tube. because ultimately the goal is to have that healthy baby in their arms. What about the family and the societal support for assisted reproduction? I'm glad we live in a country where we have huge support. In fact, we live in a very, very blessed country where we have a system like Medicare that covers costs for us, partly also supports assisted reproduction in this country. And because of that, many, many more people are actually able to avail this service and have the family that they ultimately dream of. We need to obviously think about attitude towards gamete donation. Some of us are unfortunate. We lose our eggs and sperm earlier than we should. Or maybe we were born without those eggs and sperm. And like we need a helping hand with something else, we need a helping hand in having somebody's eggs or somebody's sperm, and still try and have that family and give that beautiful life to a little child that we always wish to give. There are definitely differences in this respect between men and women. I can see why that happens. I think women are a lot more adaptive to accepting donor eggs. And that's because ultimately, even if the pregnancy is conceived through a donor egg, she carries the pregnancy. She goes through labor. She gives birth to that child. And that birth connection is a huge connection that a woman can have. She knows that she's gone through that trauma and pain. And like an Indian poet was just saying a few days back on a Bollywood program, that if ever you talk about a relationship, your relationship with your mother is always going to be 9 months more than any other relationship that you've ever had in your life, because that's the birth trauma that your mother has gone through, which nobody else has experienced. So you never tell a mother about, pain and trauma, because she just knows about it. You just don't boast about pain in front of a mother who's gone through labor. That's what it is. And then ultimately, your culture will influence how you accept failure. It's unfortunate to say that in my business, at any given point in time, 40% of my patients will be happy. 60% will be unhappy because their cycles have not worked, the treatment has not worked, they've not got there. But at the end of the day, those 40% have moved on, and the 60% are the ones that I need to keep working on. So how do they accept that failure? And in India, it's fantastic, because you see people say, oh, it was God's wish. It's okay, It hasn't happened this time. Hopefully it's going to happen next time. And that's God wish attitude really helps them to get through. I see that happening here as well. I see a lot of my patients saying, oh, it was my destiny. It doesn't matter. I tried as much as I could, and I'm going to give it a go again. And I keep telling them, it's like an exam. You do an exam, you fail it. It's not the end of the world. You have to do it once more, and that's okay. I can admit to this crowd that, in fact, the first time I did my subspecialty exam in fertility, I didn't get through. And within 10 minutes, I was seeing patients. I felt bad about it. I went and spoke to my training supervisor. And he said, Sonal, nothing's lost. You'll have to do it once more. You'll pay the college once more. You'll get through it. And within 10 minutes, I was seeing a patient, and I was back to where I was. And I was like, yeah, that's true. It happens, You fail in life, you come back, you stand up, and then you succeed. And the next time I got through, and he was right that, it's just that you have to do it once more. So if we now move on to how much impact this is going to have on our futures, the impact is huge, because I have seen, unfortunately, marriages breaking down in India. And this is not very far. It has happened in our own extended family, where somebody could not conceive, and the impact was a marriage breaking down. There are obvious expectations from grandparents that are not met if there is childlessness in the family. The woman especially feels a loss of self-esteem, because often the woman takes it on herself to say that she is supposed to get a heir to this family. There are obviously issues that are related to both female factors of fertility and male factors, but men often tie their fertility to virility and to their manhood. And that's where the problem starts, because often I have couples where the woman comes and sees me, and I say, look, we need to investigate your partner. 50% of your baby is going to come from your partner. And they say, no, he doesn't think that he needs to get investigated. There's no problem in his family. He doesn't have any problems. He doesn't have any health issues. And I keep telling them, look, probably that's not true, because 37% of couples who present to us will have a pure male factor that is contributing to their fertility issues. There are, of course, superstitions. There's blame game. But this is variable in different cultures and different religions. Religion does play a very, very big role in decision making, because there are so many religions and so many cultures where certain fertility practices are just not acceptable, to the point where I think it's a bit difficult to express it, but penetrative intercourse is actually not practiced in certain cultures, and they're still expected to have a baby, and most of them do through a variety of ways, but it is a cultural thing. So on this background, let's see what the challenge is. The challenge is 1 in 6 couples who will come to us for fertility issues. Sorry, can I get somebody to move this? Thank you. So are you going to do it from there, or do you want me to continue? Okay, thank you. It's not working from here, sorry. Yeah, can you stop there, please? Thank you. All right, so sorry about that. Technical hitches are always there. So 1 in 6 couples in Australia and probably worldwide is the average that we see having a fertility issue. And that's 15% of our population. So we are talking of a condition that is quite prevalent in the population. We are not talking of something that is rare. And can I just get you to keep moving to the next slide when I'm ready? Thank you. And if you look at subfertility, the current infertility is more in the developed countries, and it ranges from anywhere between 4 and 16%. We are likely to see an increase in this issue because we are seeing this huge obesity epidemic that is going on. We are also seeing that mean sperm counts in men are falling away. There is an increase in prevalence of sexually transmitted infections in our society, and also advancing average age of first-time mothers. And I'm going to go into a little bit of detail without wasting too much time for it. So in terms of obesity, if you have a look at this picture, it's pretty obvious that at least a quarter of our population is obese, and at least half of us are overweight. And trust me, this is a huge issue with fertility because there are so many things that obesity can affect. Obesity affects our gametes, which are our eggs and sperms. Their quality goes down. The pregnancy definitely gets much more difficult. There are lots of pregnancy complications. There are lots of complications, not only for our children, but now we have found a transgenerational effect up to 3 generations. So if I am overweight and if I have a grandchild, my grandchild has a much higher risk of getting metabolic problems and diabetes when my grandchild becomes an adult. And that's because I was overweight when I conceived my children. That's the impact that we are talking about in terms of fertility. So it's a huge impact of obesity, and we need to look at this epidemic and do something about it. The next thing is, of course, the impact of age on natural conception. As age advances, our fertility declines. And this is more specific to women compared to men, because women are born with all the eggs that they're ever going to have, whereas men can keep making sperm for their entire life. So as our age advances, our egg quality and our egg quantity both are going to go downhill. And I can see the logic of nature in this. Of course, pregnancy at an advanced stage is a huge risk to a woman's life. So nature has made this process so efficient by stopping women to have a pregnancy after a certain age. The eggs are gone, you can't become pregnant, and that's it. That's the end of your reproductive life, because nature does not want us to suffer those health impacts and our children to have those health implications when we conceive at a more advanced age. The next thing we need to look at is the advancing age of first-time mothers. We all know that our grandmothers and mothers had children between 20 and 25. We now see that the age of first-time mothers is advancing. About half of the patients that we are now seeing at Genea are over the age of 35 when they're presenting to us for the first time. This is a huge challenge because we need to promote to the community that a woman has a reproductive lifespan that's very finite. It would be best to conceive in your reproductive years and try and finish your family. Not only will it help you to conceive quicker and finish your family quicker, but also have a healthier family in that sense. And this is a message that I don't know why is not getting out into the community. And in 2021, we have couples who come to us and think that, oh, at 40, what's the big deal? I can go and have IVF, I can go and have a baby. Not realizing that even in IVF, I'm trying to use your own eggs. And at that age, probably not going to work or going to be working in a very few women. The next thing is our lifestyle, right? We all talk about lifestyle all the time because it has a huge impact on everything that we do, but a very, very big impact on our fertility. So talk about smoking, talk about excessive alcohol, talk about excessive caffeine in our diet, talk about all the plastic that we get exposed to. Everything's wrapped in plastic. We get exposures through the environment. We get exposed to all the wrong things, and that's having an impact on our fertility. That's where we need to again focus and take the challenge that we are going to change all this because we want to give a better, healthier next generation to this world. And then let's just talk a little bit about what can actually go wrong. There's a lot that can go wrong in terms of fertility, because in Bollywood movies, we all see that there's an egg, there's a lot of sperm swimming to that egg, one sperm just bangs into that egg, that's it, the woman is pregnant. I really wish it worked like that, but I wouldn't have a job, honestly. So it doesn't work like that for a lot of couples. It's not in the comfort of their bedroom that that happens. There can be problems with the woman. She may not have eggs. She may have eggs, but she may not produce them at the right time from her ovary. Men can have problems with their sperm count. There can be issues on both ends. Tubes being blocked, the uterus not working. There can be sexual dysfunction. And I can say that I see at least 4 or 5 couples with sexual dysfunction every month. And the only reason they're coming to us is because they cannot have sex, and that's the biggest problem with them, and we still need to help them with assisted reproduction. And we've already spoken a lot about advanced age. So bearing in mind that all these problems can be sorted out through either medical management or through surgery or through a combination of the two, I can't go into a lot of detail with all those fertility treatments, but I do want to introduce you to assisted reproduction, which is the cutting edge technology that we are talking about today, and mainly introduce you to IVF and ICSI, which has helped millions of couples. And what is IVF? Like I said earlier, IVF is making a baby in a plastic dish. It exactly is that. In vitro is outside the body, and fertilization is bringing the egg and the sperm together to make a baby. So that's what IVF is. ICSI is only an advanced technique of IVF, where if the sperm can't get into the egg on its own in a plastic dish, we take it in a needle and we push it in. That's what ICSI is. So it sounds very simple. It's technically very challenging. But at the end of the day, that's what we do to help people. In terms of the history of IVF, Australia actually leads the world. The first IVF pregnancy was actually reported by these two fantastic people, Professor Carl Wood and John Leeton in Melbourne, Australia. Unfortunately, that pregnancy miscarried. And who wants a miscarriage, right? We were looking for the baby at the end of that pregnancy. So unfortunately, they are not still considered as the pioneers of IVF for the world. But I can tell you, Australia was the first one to report an IVF pregnancy that actually happened after transfer of an embryo that was created outside the body. The real pioneers were Bob Edwards and Patrick Steptoe from UK. They reported their first pregnancy, which unfortunately again was an ectopic pregnancy and didn't give a baby. But they continued their work in spite of all the criticism that they faced. And then bang, 3 years later, we had the first IVF. Can we keep moving? So one more, please. So the first IVF baby was born in 1978, Louise Brown. And Louise is now 42 years old and very well known to the entire IVF community. And then if we look at IVF in India, India was actually the second IVF pregnancy in the world, which most people actually do not know, because this guy, Subhash Mukhopadhyay, who did it in Kolkata, was not allowed to report it, and what is not reported in the scientific journals is not accepted. So the first IVF pregnancy in India actually got reported in 1986 by a person called Anand Kumar. And Dr. Indira Hinduja, who I had the fortunate time of working with, was the first gynecologist who reported this first IVF pregnancy with him. But they have acknowledged that it was the first scientifically reported pregnancy. Otherwise, India would have been credited with the world's second IVF baby, which is such a fantastic achievement that I can report today. Over the years, we have made it better. We have now got better protocols. We've got safer drugs. We've got easier cycles. There was a time that women had to go through a surgery to collect those eggs that we want for IVF. Now it's a simple, straightforward procedure that I can do under some sedation and a local anesthetic, and the woman walks off in an hour and goes home. Next day, she's back to work. We're improving our laboratory techniques because that embryo that is created, that baby that is created, has to be looked after in the laboratory for the first 5 days. And that's the crux of the story. That determines the whole outcome of that pregnancy. We are now able to do some testing on these embryos, and the idea is we want to test for genetic problems so that we don't pass on genetic problems to our offspring. The idea is not to create any blue-eyed, curly-haired babies, which is a wrong impression that people have in the community. Certainly, we do not do that. We don't even do sex selection unless it is for medical reasons, as per the laws in Australia. And of course, all this has given us a better understanding of the human physiology, because when things happen in the laboratory in front of your eyes, your understanding is much better than when it's happening in the uterus where you can't just see what's happening. In terms of the, the previous one. Yeah. We've also made some very rapid progress in our culture media and how to look after eggs and embryos in the laboratory. We focus a lot on research and development. We invest about 15% of our revenue every year in research and development. And now we have a lot of data from these pregnancies, and that helps us to look after these pregnancies very well. And of course, there's this huge impact of media and social media that impacts everything in our life. In terms of Genea, it's a history of innovation. We started in the backyard of Royal Prince Alfred Hospital with 2 people as staff, and now we have a company that employs more than 500 people and more than 51 doctors working with them. This has all happened in a span of 36 years, and now we have 3 companies which look after the fertility, after the research and development, and the world's first IVF stem cell bank that we now have. So very, very proud to be a very, very little part of this association. And it was all because of the vision of this man, Robert Jansen, who was our founder and our MD. He had more than 35 years of experience in this field. And I always said that if I have as much knowledge as Rob's little finger of reproductive medicine, I think it'll be enough for my life. That's how genius that man was. He was a visionary, and all the breakthrough development that we have today is because of what this man did. Unfortunately, he lost his battle with cancer about 6 years back, and we don't have Rob amongst us today, but he's always present wherever we are. Let's have a look at the numbers that we have. So in Australia, the last reported data is from 2018, because we always have to wait for a couple of years for reporting. And you can see there that we've been able to give in 1 year about 16,000 babies through this technology, which means we've brought joy to about 16,000 couples or individuals to have that family that they always wished for. And what about the global scenario? After 40 years of a heavily criticized technique that was introduced in 1978, we now successfully have more than 8 million IVF babies all around the world. It's about 500,000 deliveries that we are talking about per year around the world. So this technology certainly brings a lot of joy, and that's the only reason that I am in this field. And what does the future hold for us? We obviously want to keep going on with our technological advances, have simpler protocols for our patients, focus a lot on fertility preservation, because a lot of us are going to lose our fertility earlier than we should. Just as an example, if I have chemotherapy tomorrow, and if I am 25 years old, which I certainly am not, then I would lose my fertility. In my case, I wouldn't worry about it because I've probably lost it anyways through age. With advanced fertility treatment options, we are looking at stem cells. We're even looking at transplanting uteri for women who don't have a uterus. We need to use this technology judiciously, and we all understand that. We can't use it willy-nilly. We are not going to have excessive risk with this technology. And from my point of view, we are trying to have the best outcome, which is the birth of a singleton pregnancy at the end of a healthy singleton term pregnancy. That's what we are trying to achieve. I feel so proud and privileged to be a part of every little family that we have been able to create. I get a card sometimes on Christmas and say, oh, now she's 5 years old and now she keeps talking around and walking around the house. And now she's the boss of the house. Do you know that? And I keep saying, yeah, she must be, I'm sure. And I look at that child and I sometimes say, you were a little dot frozen in that little tank at minus 196 degrees, and look at where you are today. And it gives me immense pleasure to say that I become a part of that family, and I remain in that family forever because I have been able to give them that little child, that little baby, and that little family that they wanted. So thank you all for your patience. I hope that I've given you some insight. Thank you very much.
Seemingly small things actually impact us every single day, and they impact our children. Because little girls hear that, and little boys hear that. They hear that. We need to be better, and we need to be better now. So I'll be marching tomorrow around Parliament House probably several times, as will virtually every one of my colleagues on the Labor side, because even if I didn't agree with them, and I actually do, even if I didn't agree with them, when people speak and say this matters, we're obliged as Member of Parliaments to hear them fully, and put on their suit, put on their jacket. See, that's another one. Put on their, whatever the female equivalent is, put on their, just wear what they believe for a few days to explore what it feels like. We're obliged to do that. And every one of us should be out there doing exactly that, because these women, large numbers of them, have been there and they've been silent for far too long.
Thank you, everyone. Thank you, inspirational speakers. It was really, really important to touch workspace, health, finance, and infertility, very significant topics. Um, I just would like to say, lastly, do we still need to celebrate International Women's Day? People would say we have a premier, which is women. We have so many positions, girls that are on CEO positions. But yes, there is no place for complacency. According to World Economic Forum, sadly, none of us will see gender parity in our lifetimes, and nor likely many of our children. Gender parity will not be attained for almost a century. There's urgent work to do, and we all can play a part. So thank you for your time. I'd like to thank our sponsors, Genea, Orchid Fashions, and Indian Matrimonial for being our sponsors today. I would like to thank our dance participants, which is Vandita Vats, Soumya Rao, and Komal Bhausar. We would also like to thank Shobha Englishwar for coming over, spending her time, and getting her team, and showing wonderful performances. Apart from providing delicious food, Kamaljeet and the Paravilla team have been very helpful and adjusting to make this event successful. Thank you so much, Kamaljeet. Last but not the least, thank you team, thank you UIA team for organizing this.